would like to talk about the fact that the three of us are probably some of the last people in the organization that had the pleasure of working directly with Dr. Jones and being influenced by him when it comes to taking care of those most in need.
Absolutely.
That mission and the care, and that he said he loved drug addicts, and he did, because they have gratitude, and it made him feel good that he was helping the neediest.
Yes.
And so I think each of us started at a different time, has a different story. You've been with the organization the longest. You're always our first, because you are our first 30 year, then 35, and now I think it's 40 years this year.
40?
In October.
Oh my gosh.
Isn't that amazing?
Yeah.
Wow. So what year was that then?
That I started in 78 as a volunteer.
78. And then I was 82 and you
And it
were
was
84. Yeah.
On that same era. So
Were you at the big house on 4th and E?
yes, I was.
They had already moved there
Yep,
by
they'd
then.
already moved there, and it was just general medicine, women's health, and detox. So I started as a volunteer in birth control, and then after maybe 4 or 5 months, the position opened up for a women's health manager and our coordinator, and I took that, and basically I've been there since, although my jobs have changed many times over the years.
Yes.
Yeah.
But you've been pretty consistent in primary care and behavioral health services.
Correct.
don't you think?
Yeah.
And women's health.
And
And women's
And
health,
women's health.
absolutely.
Yeah.
Yeah.
Wow.
And how about you?
Well, I came in 82, and I came in also as a volunteer. The perinatal program was just new. I think it was maybe a year in. And I came in, I got told about the program I was a midwife, and I think I had helped one of the woman that was a coordinator of the perinatal program, Catherine Gorshoff, have her baby.
Oh, I remember
And yes, Catherine.
Yeah.
And she told me about the perinatal program, and I volunteered, and I was just finishing my nursing school as an RN at Sac State. And and Catherine left, and I got her job, and it was a job share with Laura Hogan.
Oh, that's right. Yes.
Yes.
That's right. Yeah.
So was Laura there already?
Laura was there. She had job shared with Catherine, and then a week after I came, Laura went out on maternity leave. And
I remember that, and you had to run the program.
well, not only that, but
And you
I
had
got
to-
a phone
I
call
remember.
from UC Davis, where our babies were born, saying they would no longer deliver our babies.
Right, I remember that. It was really a huge
I knew
crisis.
nobody in Yolo County. I lived in Sacramento at the time. So I just got the yellow pages out. I went down the yellow pages, looked for obstetricians, and we had a Mimeo machine. It wasn't even a Xerox machine, right? We had the Mimeo with the drum. I made a Mimeo, sent it out to all the obstetricians that I could see in the yellow pages in Yolo County. Leon Skimmel called me back and said, let's work something out.
Yeah, I remember you told me that.
It was amazing.
It was wonderful. We were really lucky
And
and
he's
very
been
happy.
with us since.
He's been with us ever since.
35 years.
So I
And how
think
about you?
I think what we have in common is we all started as volunteers.
Yes.
So I was very pregnant with my son, and I'd left a job and just wanted something to do. And somebody said, "Do you know about the free clinic?" And I already had a master's in public health, and I was really oriented towards public health. And they knew that was my interest. And I said, "No." They said, "Well, go over, and you can, help out and stuff." And I went in. I walked into that building, and it felt like home.
Yes. Yes.
It did. It just felt, I don't know what it was. There wasn't even that many people around, and it just felt like home.
Yeah.
And so I started volunteering at the time. I started volunteering for the board, and that was actually a lot of fun.
Oh.
And then Denise was the general medicine coordinator.
Yes.
And we had a little subcommittee, so I got to really know her. And she goes, "Robin, I'm leaving. I want to do something else." Because I think she was like if our background was in philosophy or in English or something, and she said, "Why don't you apply for the general medicine coordinator?"
Oh.
And I did. I did. And Lorraine was one of the people that was on the hiring committee. And I always tell this story. Years later, I got to hire her back. Not that she really left, but as a PA, you did have to reapply.
The full circle.
Yeah. So I, and that, the rest is history. So general medicine, and we had, at that time, we didn't have one executive director. Do you remember we had an executive director team?
That's right.
It was so 80s. The executive director team.
So
and we worked it out, and I, through the years, what we always looked at was what was the need. Right?
Always.
Well, we weren't doing pediatric care or newborn care for our babies. Midwives did, but we didn't have a pediatrician. And then we also didn't have dental.
Yes.
And so we worked on starting those programs.
Yes.
Doesn't it seem? It seems unbelievable that we didn't have those services in those days. And I always remembered Dr. Jones. He never said anything, but he would comment when you did something like that, when you created more access for more people.
More people.
He was very practical, and whatever we did was fine. And I remember when we had the open house for the dental, and it was on G Street. By then we were on G Street. And we actually had to take out the couches that had been for behavioral health, and behavioral health had to move to West Sacramento because they didn't have any room, right?
Yeah.
And so, and he said to me, I'll never forget it, and I didn't know what he thought, and he said, "It's like having another grandchild."
Oh,
isn't that a really nice thing to say?
I mean, we were so lucky to know that guy.
Yeah.
He was,
amazing.
I can remember, he was so supportive of the whole idea of having midwives deliver our babies. And what he told me was that when he was a young kid, he would go around Georgia with his dad in a horse and buggy. His dad was an old-time GP in Georgia, and help his dad. What's that? Arkansas. And help his dad deliver babies. And before he died, Dr. Jones gave me this pair of scissors that his dad gave him that were used to cut the umbilical cord of those births in Arkansas.
Wow.
And I framed it, and he wrote me this beautiful letter. But
So we still have
he
his
was
black
wonderful.
bag that he used
do?
when he would do home visit. I don't know what was his dad's.
His dad.
I bet that was his
and we
dad's.
we have it in a case, enclosed case in the behavioral health entryway in West Sac. Right?
Oh.
Yeah, I think it's moved to Salud, but it's there. It's in
okay.
the same building.
Oh.
Yeah.
Okay.
Yeah.
Yeah.
I've never seen that.
Yeah,
I'd
it's
love
really
to see
cool.
that. Those
It's really
scissors must have come out of that bag.
Yes.
It's one of
Yeah.
my
Yeah, but
prized
he has an
possessions.
enormous influence, and we were very lucky to have known him. And he one of the reasons that his memory, and we
absolutely.
we were really truly
Yeah.
lucky.
So he would go
Absolutely.
with his dad. He was homeschooled. He didn't attend a public school or private school. He was homeschooled. His mom had been a teacher before she got married, and he would, when his dad had a house call, he would take John. I guess I've never called him John, but anyway, with him, and he would remember different diseases by the people that had them. Like he remembered somebody with the diabetic foot, Mrs. So-and-so or whatever, and so he would connect that way. And sometimes they would tell him, well, we can't pay you now, but we can pay you in the fall when the crops come in, or sometimes they pay him in food and in vegetables. And I remember he told me that at the end of the year, he would tear up all the outstanding bills and start again. And he was really influenced by his dad.
Yeah.
It's a true.
Yeah, I mean, that's why he didn't
True
like
healer.
private practice.
Right.
So that's
Yeah.
why he started working for student health, because he was
Yeah.
on a salary, right?
Yeah.
He didn't really have to ask anybody. And then what happened, which is so fascinating, if you ever saw him and knew him, that he did rock medicine. And he was really influenced by Haight-Ashbury
Yes.
and what the
The
clinic was
Haight-Ashbury
doing
Free
then.
Clinic.
And of course, all new people had to go. I had to make the pilgrimage to Haight-Ashbury with Dr. Jones, which was really fabulous. And actually, the person that we connected with was the pharmacist. Because they did so much, they had to know so much about drugs, and they had to know how to help people. And so, yeah, a pharmacist makes a lot of sense. So anyway, so he did rock medicine, and even continued to do that for many years, even after he founded the free clinic. So he came back to Davis, and he realized there's problems in Davis too. There's young people that are addicted, but they also have sore throats or skin infections, and they need primary care. And that's what he did. I mean, that's how really the clinic started.
Exactly.
The Davis Free Clinic.
So he started volunteering with the Haight-Ashbury Clinic in the Summer of Love in '67, and then he started working the next year. He would still go down there, but he would work the next year. This was all in addition to the Student Health Center at the Aquarian Effort at night.
That's right.
In '68. And then, like you said, because they knew that he realized that these people weren't just overdosing on LSD, they had STDs or other coughs or whatever. And so I guess it was first the Diogenes house that we mentioned, which was sort of a place that you could crash and recover if you were overdosing on acid or whatever. And so he would go there and treat the people there. And then by '72, they realized they really needed to start a real medical clinic, and that's when they started that. Yeah. So, and first it was Diogenes. Diogenes. First they were treating people there, and then they went to the Quaker Meeting House, which is on L Street, I believe. Yeah. And they would put up these little partitions and take them down at the end of each clinic. I don't know how often they had the clinic. Maybe it was once a week. I don't know. And then they were, for a minute, they were in downtown Davis, and then they got the house on 4th and E, which was great.
The big house.
Which is where we all started, I believe.
Which is where we all started, yes.
Yeah.
The big house with the
It was hilarious.
garage.
Well, it was an old 2-story house, right?
Yes.
And the pregnant women had to go upstairs. The bedrooms were the exam rooms.
Yes.
There was one bathroom upstairs for people
Yes.
to do samples,
Yes.
and there was a little room off to the side that was kind of the pharmacy, where there was a
Yes.
shelf that could be locked.
That's right.
Yeah. And
Oh
the
my
waiting
God.
room, was
It's
part
the
of the living room,
room.
and it had a very nice porch outside when the weather was good.
Yes.
The kitchen was the lab.
The lab.
And then there was a room in the back where we would take people to find out what they were going to pay on the sliding fee scale.
The
'cause
dining
everything
room.
was
That was the
donated.
dining
room.
That was the
The
dining room. So
dining
everything was
room.
donations, right? There
Everything.
Well,
was
except for Family Pact. I mean, it was SOFP.
we were doing Family Pack then.
Probably not at '72, but by
No, but when I was in the beginning,
'76,
well,
maybe
even
we
when
were.
I started,
Yeah.
we weren't doing very much. That's why we started. That's why we wanted to change the name, and we wanted to be able to bill. So as a free clinic, we couldn't do that.
But that
and
was
we came to the realization that we really could bill a lot more things and be more sustainable. And we had to do that. And I thought, oh, what will Dr. Jones think? Well, he thought, be practical. No margin, no mission, right?
It was
So,
a big
it was a
discussion,
really big
though,
deal.
and I remember being
Really-
very
and you know what
nervous
it
about
was?
approaching him.
CHDP, Child Health and Disability Program, from the county. One of the public
Yes.
health nurses came and told us about it. And I said, oh, this is so great. We can bill for children's visits. She said, oh yeah, this program's been going on for a while. And I said, you just told me about it? We could have been doing this for years, right? Yeah. And so that was one of the first things we built, and we really felt that even though we still always said at heart we're free clinic people, that we needed to be a community clinic so that we could start billing.
Yeah.
And we did, and we learned a lot about that. We eventually became Medi-Cal providers. And Medicare providers, and really just learned all along the way.
Along the way.
Yeah, and people ask, and really to this day, we weren't even a federally qualified health center until like
No.
11 years ago.
In my mind, that's very recent.
It is recent. It is recent.
In my mind.
We were
Isn't
always just sustaining through grants and fundraising.
Yes.
And,
Oh,
and patient payments.
fundraising.
Yeah.
Oh, Lord.
And at the same time that all this was going on with the medical part, the heroin detox was started right along in
Oh,
72.
that's
The little
right.
house next door at
The
414
little
East
house
Street.
next
Little house
door.
next
Yeah,
door.
yeah.
That's right.
And so Dr. Jones would come there every afternoon pretty much after his morning
Yes,
at the Student Health Center. And he would sit around and talk to the counselors, talk to the clients there. I would bring
He was medical
charts.
director for a while.
Yes. And I would bring over charts from our women's clinic for him to sign because he had to sign them all. And I had a lot of interesting conversations with him over
He
there.
was fabulous.
It was loose back then.
Yeah.
It was loose.
Well, even when we
I
moved to
kind of
G
love that.
Street, you know, we consolidated all of the sites, and there was a few of us that lived. Not lived, but well, it felt like lived, but we worked in the
close.
little garage outside, and we knew we had to leave when mushrooms were growing on our desks. And I'm not even making that up.
I know. I was in
It-
that garage
It
before
was
you were.
unbelievable. So that's when we started looking for a new space and did some fundraising to figure out how we could get there, but it didn't cost that much. And the co-op, they were great. They let us have about 5,000 square feet, which is
Yeah.
what we needed at the time. And we were there for about 10 years until we realized we need at least twice the amount of space. And we told them we'd like to expand, and they wanted to expand. So they were really nice about it, but we had to find our own place.
Yeah.
And that's when we searched and figured out that building our own building would probably be the best. And we found a really good partner in Sutter.
Really good partner.
Really good partner. And they were developing their own campus at the time. And we came to talk to, I think it was Pat Fry, he was the CEO of the hospital at the time. And we said, well, how about having a community health center on your campus? It'll really help keep unnecessary inpatient visits, unnecessary emergency room visits. And he said yes. He just said yes. And I said, oh, okay, so now we're going to have to do it.
We have
So
to build a building.
We have to build the building. And he designated where it was, and yeah, that was a start of a very good partnership.
Yes.
Being on their campus.
And it still is a
actually.
good partnership.
Yeah.
Yeah, absolutely. The perinatal program, we started out because people saw farm workers in the field pregnant and were wondering where they were getting care, and it turned out that they really weren't getting care, and they were just showing up at Woodland Memorial. This
Yeah.
is pre-Sutter Davis Hospital, you know, in labor. And the at that time, Medi-Cal did not cover undocumented
That's
women.
right.
So we got a grant from the Department of Health Service that we had to re-grant every year, and it really paid very little. So most of the providers were volunteers.
That's right.
It
That's
paid Laura and I to job share a pittance, and I think we had an AA in there, but that was it. And then as things progressed, and I decided to go to midwifery school and somehow come back to Yolo County and deliver these babies myself. During that time I was in midwifery school, the great state of California started covering undocumented women, and
It's
that really
very,
let the program
Very unique.
thrive
Very unusual.
in the United
it's
States.
and still is being funded to this
Yes,
day. Yeah.
still
Still.
state funded.
Well, it makes a lot of sense that
Yeah.
all of these people were citizens, right?
Yes.
Particularly the babies. You
yes,
might as well
all
have
the
healthy
babies
citizens,
are citizens.
right?
That's right.
Yeah. So
That's right. So
So, and I think you brought another
That
thing
really
up that was
helped
kind
it.
of really important about the beginning, is it was really a volunteer organization.
it was.
It wasn't just us.
Right.
Even when we were staff and we were being paid, we were totally dependent, at least in general medicine and pediatrics and dental, totally dependent on volunteer dentists,
100%.
physicians,
Right.
nurse practitioners.
Yes.
And in fact, we only did in the beginning when we were at 4th and E. We had clinics only, general medicine, were Tuesday and Thursday evenings. And had to be in the evenings because that's when people got off from work.
Yeah,
Yeah.
Volunteer.
Yeah.
the
So
volunteers.
the
Ours
volunteers could
ours
work.
were Wednesday
Yeah,
nights.
Wednesday night was perinatal, general medicine was Tuesday and Thursday, and women's health was Monday
Monday evening and Tuesday afternoon.
and Tuesday afternoon. Yeah.
And I always came in on Tuesday and Thursday evenings because I couldn't stay away. I mean, I just stayed all day into the evenings. I mean, I couldn't. It was like missing what the action was.
It was
It
exciting. It was fun. It was really
It
fun.
was
Yeah.
so. Those were
I
golden
was young
years.
enough to be able to stay up at 11 o'clock at night
Yes.
because a lot of times we did not leave
No,
until
no.
10, 10:30, and then we had to
Oh,
clean up.
no.
So I didn't get home until 11.
11:30.
Yeah.
Absolutely.
Yeah.
Bike
No,
home to
yeah.
the domes through campus
Yeah.
at 11 o'clock at night.
Yes,
Yeah.
11 o'clock at night.
But you know,
Absolutely.
I was reading and looking up more about Dr. Jones that he actually did an OBGYN residency, and he
know
delivered
that.
500 babies in 1 year in Mare Island. It must have been through the Navy.
During the Navy.
Yeah.
didn't know
I
that.
That's in
did
the
not know that.
Yeah.
Maybe
No.
that's why he had such an affinity.
Yeah, yeah.
Because he really
makes sense.
understood what we wanted to do.
So Barb, when you were talking about the services to the migrant population, it's really interesting because that's always been a very important part of the
Yeah.
services that we've provided. And over the years, we have really made sure that we keep staff, that we have staff who can speak the same language
Yes.
as people that don't speak English,
Yes.
and particularly for us in our communities, it's Spanish.
Yes.
And so that's been very important culturally and linguistically. And actually we have kept those services going. And when we became a federally qualified health center, we're actually a migrant health center.
I know.
And
I'm proud of that.
I know.
I feel really good about that.
And there are special population. We do still do particular and special outreach to the migrant and farm worker population. And in California, less and less people are migrants and more seasonal farm workers.
Seasonal.
And that's fine. It's a thing more peculiar, I
Yes.
think, to California than other states.
Yeah.
So it's just been become a big part of our mission.
Yeah.
And I think that a lot of that comes from Dr. Jones. He started us on that.
Right, yeah. He would go out to, apparently, to what is now Cactus Corner. I don't know if you know Cactus
Oh,
Corner
yeah,
on
I do.
Road
Yeah.
98.
Yeah,
Mhm.
yeah, it's usually how I come here.
And he would go out with his son, and his son would bring a bat and a ball and some candy, and he would keep the kids occupied, and the labor contractor would organize the patients that needed to be seen. And so he would just go through and see those patients, and then
Out of his car.
yeah, or probably.
And it was
yeah.
before he had a place to refer them to.
Right. This was before the Davis Free Clinic actually started. But then, he remembered those people, and they were a big part of our initial perinatal population.
Yeah, they were.
The vast majority of them. Yes. We had this woman, Lulu Hernandez. I think
Yes, I
those
remember
Lulu, those communities, there's someone like that, and she knew who needed prenatal care, and she took it on herself to get people in the car. Of course, we didn't have appointments. It was first come, first served. And she would gather them, as many people as she could fit into that station wagon on Wednesday nights, and bring them in for prenatal care. And then word of mouth took
it was
off
really
that they
strong.
got. Yes,
Word
and
of
that
mouth
people
was really strong.
That people
for
got
all
treated.
of our programs.
Yes, but it was because they're treated so respectfully.
It's also because there was such a big need.
Yes. Yes.
There was a really big need, and we've worked over the years. We've worked very hard to meet the needs as much as we can. And there always is need for more access.
Yes.
For low-income people.
Always need.
Yeah, I mean, even now it's the same. There's still so many people that actually don't have coverage. Still to this day.
To this day.
And that's why we're here.
Yes.
And we have known how to sustain ourselves so that we can serve those truly who have nowhere else to go. who really can't
Yes.
afford. And my core belief is that everyone deserves quality health care. Everyone.
Yes.
Access to quality health care.
Yes.
And we should be in a society that values healthy people, that values prevention and care for those that no one else will take care of.
Yes.
I mean,
And I would add to that, Robin, quality health care delivered in a way that maintains the recipient's dignity and given in a very respectful manner. And I feel like CommuniCare, don't you think? Don't you think
we've worked
we
really
excel
hard to
at
keep
that?
that.
We excel.
We really do. I think
Yes.
it's really important that we never forget that.
I agree.
That, yeah.
And our latest, well, I don't know if it's the very latest because new things keep coming up all the time, but our CREO program is one that offers mental health or behavioral health services to people who don't have coverage.
Yes.
In the form of counseling and also in the form of groups. We have an outreach worker that is bringing people into groups here to talk not just about mental health, but about everything from gangs for their behaviors in our cities that or in Yolo County that might be helpful for the parents that are attending to different holidays or whatever. I mean, there's a lot of programs that are going on that are really educational that are being planned for these clients. So
Yeah, it's a wonderful program because it's a
Wonderful.
population that isn't always comfortable coming in for mental health issues.
Right.
Yeah, and so I really believe in that.
Yeah.
Our all of our programs have grown. They've become really stable, clinically high quality. We work really very hard on quality initiatives, and we still haven't forgotten the heart of what we do. And I think that's really the success of the organization. I know that's why I've been here for me it's 34 years. I'm new
35.
compared to Lorraine and Barb.
Well.
But you could just see it. You could just see it when people walk into the waiting room. You can see it in the eyes of the first people they see, who are our patient service representatives.
Yes.
You can see it in the way that the MAs, medical assistants, greet the patients.
Yes.
You can see it in the way the providers give care.
Yes.
And we got a lot of
It
really
is a
wonderful
difference.
comments. But we really do in dental. You wouldn't think it, but most people really don't want to have dental care, and then they walk out and they're really happy.
Yes.
So
I've heard that too.
yeah, I mean, it's really a joy to see that. And we do a lot. I do a lot of administration. And for me, it's really important to be connected with one of the centers, so that I
Absolutely.
can see this, so that
Yes.
I know why I'm waking up every day is to help people.
Yes. I feel like that's been one of the keys to the success of the programs, the CommuniCare Health Center programs, maintaining the heart of it, is that administration is connected to the clinics. We're in the clinics, and it's easy to go through the front door and see patients. I feel like has been a key to how connected everything is. Administration and the providers are.
We work really
all
hard at it. I
connected
will
with
say
that.
that when you're in 3 main sites, it gets a little
Yeah,
harder.
a
You have to
little
really
harder.
work at it. But I
Yeah.
feel like we do.
I
mean,
do too.
I really try to get out to this beautiful new building, Hanson Family Health Center. We're very proud of
Gorgeous.
this building, and I'm really proud of Salute Clinic in West Sacramento.
Yes.
I'm really proud that it also integrates all the services into one site as we do here. I think that's really great for the patient. It's really great for providers, so they know they have somewhere to refer.
Yeah.
And so, yeah, I think you can see as we've grown how we've done this, how we've tried to incorporate the initial values that we started at when we were volunteering.
Really, that healthcare is a right.
Yes.
and not a privilege, and
And
that's
that was
really-
over
That's it.
the sign as you walked in the Davis Free Clinic. Remember that?
Yes.
Yes.
Carved by
Yeah.
Bill Davenport.
Is that who did it?
Yeah.
And
He
it's
was here
still in
when
our
I
mission
came.
today. We have
That
we have
can't ever
wordsmithed
go.
a little bit our mission, but we have never changed the final bullet point that healthcare is a right and not a privilege.
Yes.
We've never changed that.
I am so proud of that too.
We could be a model for the nation.
We should be a model for the
are a
nation. We
model.
are.
I think I've been here. Well, first of all, I turned around and it was 34 years.
Yes.
It wasn't. It
Oh my God.
wasn't a big, huge plan. It wasn't a plan to be CEO. It wasn't a plan to do a lot of the things that I did. I did actually take 2 years off to actually stay home with my son when I thought he was the right age that needed a parent around and
Yes.
not to be a latchkey
Junior
kid.
high.
It was junior high.
Yes.
And by the time he was going into ninth grade, he didn't want to see me anymore.
Yeah.
So I did take a couple years off, but I never, even when I did that, I still wrote grants, still facilitated the retreats, the annual retreats, actually did some reports on some of the grants. So I never totally stopped.
Wow.
And it was pretty natural to come back. I have stayed for a couple of reasons. Again, I like waking up every day and knowing that what we do is helping people that need it the most.
Yes.
So I really, and actually, so I think I have a lot of respect for our patients. I don't know if I would be able to maintain a home, send kids to school, and eventually to college as a farm worker. I don't know if I could do that. And so I really have a lot of respect for them. And I really love our staff because I have a natural inclination to love someone that works for CommuniCare Health Centers because they
Yes.
are there for the mission. Now I
Yes.
know we have a wonderful HR director, and she said she thinks that they stay because of the mission, but I think a lot of people also start because of the mission. And you can hear it when they talk. When we do new employee orientation, you can hear
Yes.
how happy they are to be in an organization that helps people.
Yes.
And I'm also, so I it's our staff. A lot of them I've worked with for many, many, many years. I also am very proud of the growth of the organization.
Yes.
Actually, it feels organic. It's been planned, However, I think we have a lot of buy-in from everybody to make those changes, and I'm really proud that now we serve 114,000 visits, 26,000 people. That's a lot more than when we started.
Yeah.
And you want to reach more people. You want to be able to help. You want to help
Yes.
everybody that comes to your door. And so I think that's why I have loved the challenge of keeping a health center open and growing. I did really like that as well. And like I said, I loved advocacy. I'm really happy to advocate on behalf of health centers for a lot of the funding that we get.
Yeah.
And I also love when I go out to the health centers and I give the pins to people for longevity. So we have, it starts at 5 years and every 5 years. So I love that. I'm really, when somebody has worked for our organization for 5 years, at 10 years and 15, that's really meaningful to me.
It is. It really is. I think for me, 35 years, when I talk to people and they can't believe that I've been in one place really, basically for 35 years. But I think, why would I leave the organization? It has grown in ways that none of us, I think, at this table could have imagined, right?
Right.
None of us. And it's grown with such heart. And that's why I've stayed. I can't imagine spending 35 years of my life working for money. I've been here working for the heart and the mission, and really this heartbeat that is inexplicable that you feel in every single clinic. Every single clinic. Don't you feel that? And and when I go to orientation, I always say it's the grace of Dr. Jones has permeated every little piece of what we have. But it's been a true pleasure being at CommuniCare with the free clinic, the community clinic, and now CommuniCare Health Centers.
Yeah. Yeah.
How about you?
And I, starting as a volunteer and then kind of helping to manage the place, and then going back to school and becoming a physician assistant and coming in again and seeing it grow. It was like your kids growing up, and you realize that they have their own lives, and so we have all these programs that I don't know. I mean, I can't do prenatal care, and I don't do dental, but it's wonderful, of course, but it's wonderful to see all these things flourishing and seeing new needs being identified and addressed. And our child psychiatry, we've just had that. There's a team that goes out with the county. There's a whole county team of kids dealing with kids that are being trafficked. I mean, we have behavioral health counselors that are working with that team so that they're trying to get the trust of those kids so that they can kind of get back home and kind of help the people at home to kind of, anyway. It gets complicated, very complicated. But there are these things that are going on, these problems that we see, these issues that we see in this county that we are really a big part of the solution in a lot of ways. I lived in Ethiopia for 5 years, and I always thought, well, I want to go back out into the less developed world, the third world, and do some medical care there. And of course, then you have kids, and then they have to go to school, and then you just never leave, right? So, but at CommuniCare, there's all these people of different cultures and languages and learning Spanish. It's been really wonderful to deal with the patients, and I think, as I mentioned before, it's exciting. I mean, it's exciting to be part of an organization that is always growing and looking at itself and seeing where we can improve and how we can do things more efficiently and effectively. At the same time, I really enjoy seeing the patients and being with the patients and learning about their lives and helping them with what I can do, or referring them to somebody else who can help them more in different ways. And I find that I learn and gain as much as the patients gain, probably, each day. And the heart that you're talking about, I think that's a great analogy. When I also took some time off when my kids were born, and at one point I thought one of my sons had an ear infection, and I didn't have one of those little plastic speculums that you put on the otoscope. So I came down to the clinic on G Street and I looked in his ear with and it was fine. And Dr. Jones was there, and he walked me out. So I was going home because I was not working there at the time. And he walked me out for a minute anyway. So he walked me out to the door, and I'm going to cry actually. And he said, what did he say? He said something to the effect of, it's nice to see you. And I turned around and I said, my heart is here. My heart is here. Yeah. It's my second family.
Oh, absolutely.
Yeah. So it's just been, great being here.
Yeah.
This is a story that I tell at the end of my section in the new employee orientation. It's really true, and I start out with that. Now it's happened about 4 or 5 years ago, but I was walking through the waiting room at the Davis Community Clinic to go to the orientation, actually. And there was a woman, she looked a little familiar, and she stood up and she said, "Are you Robin?" And I said, "Yes." She said, "Well, you probably don't remember me. My name is so-and-so." And I said, "Well, you look familiar." And she said, "I just want you to know that when I came to this country, I was new to the country. I had a baby. She had fever. She was crying, and I didn't know what to do." And she said, "Luckily, somebody said, go to the Davis Free Clinic." And I was like the clinic manager, a coordinator, and she said, "Everyone just treated us so wonderfully. You had the medication there that I could give to my baby, and she said, I remember you because you made sure that everybody got that kind of care." And I tell that story because you never know what you do that touches somebody's life, that they remember 20 years later, that they want to tell you 20 years later. Because by the time she told me this, I think her daughter was in college.
Yeah.
And I tell this story at orientation. I always break up. I can't help it. And I just thought it was a perfect way to exemplify what we do.
Yes.
And what we've done. And this was the free clinic. This is when she was coming to the free clinic.
Yeah.
So, and we've gotten even better since then.
Oh, yeah.
So
we have appointments now.
Yeah, I know, we have appointments. And we have a fax machine and computers. I fought against a fax machine. Why would we ever need a fax machine? So anyway, so I just have to say that it's been wonderful talking with both of you. I learned a lot about both of you, actually.
Yes.
And I really appreciate you.
And I feel like
this.
the three of us really brought Dr. Jones into the room. I really feel like he's
always there.
He's always here. Yeah. Yeah.